So we will start with my good cardiothoracic friends, if they can turn their video on. So I will ask them to briefly introduce themselves. So Dr. David.
Thank you, Dr. Yang, and thank you to Dr. Yang, Dr. Sachdeva, and the committee for the invitation to join you guys tonight. I am Elizabeth David. I'm a general thoracic surgeon from the University of Southern California in Los Angeles. And just a brief background on me. I went to medical school at Georgetown and did my general surgery training at Georgetown, and then followed that up with cardiothoracic surgery residency at MD Anderson in Houston, Texas. Moved out to California in 2012 when I finished my training, and have been out here for the last 10 years. My clinical focus is primarily thoracic oncology. So I do a lot of lung cancer, esophageal cancer, and mesothelioma. And I am a big education advocate, do a lot of educating of our own residents, and then a lot of work nationally on the education front. I also am one of the very active peer reviewers and one of the deputy editors for one of the journals in our specialty. And that's a aspect of my job that I really enjoy. Lots of reading and writing related to that. And I am a surgeon mom, and I'm a mom of one right now, and then expecting the second in December. So I'm happy to answer questions about that if there are any.
That I did not know. That's something I can't see on Zoom. So congratulations again.
Thank you.
Okay, Dr. Zito.
Good evening, everyone, and I want to echo the gratitude. It is certainly an honor and a privilege to be here today. So thank you very much to the physicians, ACS leadership, and of course, the ACS staff. We really appreciate your support. So again, my name is Wilson Zito. I am currently residing in Philadelphia, Pennsylvania. It's an honor for me to be on faculty at the University of Pennsylvania School of Medicine. I am in the division of cardiothoracic surgery, or specifically in the division of cardiac surgery or cardiovascular surgery here at Penn. And my subspecialty, which I'll go into a little bit in some description, is focusing in adult cardiac surgery. My background, I grew up in Virginia. I went to my undergraduate at the University of Virginia, and subsequently went on to Medical College Virginia, Virginia Commonwealth University for my medical degree. I was fortunate enough to match here in Philadelphia at the University of Pennsylvania for my general surgery training. And I was attracted to go into the field of cardiothoracic surgery, where I subsequently stayed for a residency and advanced fellowship. And I've been very fortunate to have been on staff here in the adult cardiac surgery realm since 2005. My clinical interests, to sort of get a little bit more granular, obviously adult cardiac surgery, but really subspecialize into structural heart or valvular disease and thoracic aortic disease, not only open surgery, but also the new arena of catheter-based or endovascular surgery. So that has been very interesting for our field as we have now evolved to these type of hybrid training, which we can talk about in a little bit. So it is an absolute pleasure for me to be here tonight. Thank you very much.
Thank you, Dr. Zito. And I'll also point out, Dr. Zito recently won one of the most coveted teaching awards in thoracic surgery, the Socrates Award, given out by the Thoracic Surgery Residents Association. And
thank you.
I actually, I sort of recognize you. I went to MCV as well, but I think you were a couple years behind me. Dr. Turek.
We heard great things about you. You were a legend. I remember coming through as a medical student. You were a legend.
Right.
Hi, it's a pleasure to be here. Thank you, Dr. Yang and Dr. Sachdeva. My name is Joe Turek. I'm the Chief of Pediatric Cardiac Surgery at Duke University. I'm also the Executive Co-Director of our Pediatric and Congenital Heart Center down here. My background is I'm a Chicagoan. I did my undergraduate at Northwestern University. I stayed in Chicago at the University of Illinois and did my MD PhD time in medical school. I then went down to Duke University where I was a general surgery resident. I stayed on for my adult cardiothoracic training, spending a little bit of time down at Texas Children's Hospital since I knew I wanted to do peds hearts afterwards. I spent a year at the Children's Hospital of Philadelphia, where I did my congenital certificate in peds heart surgery. My first job out of training was at the University of Iowa, where I eventually became the chief of peds heart surgery there. And I came back home to Duke 4 years ago to lead the program down here. So my training path is a little bit longer. It was in total about 17 years after college, 8 years of MD PhD, 5 years of general surgery, 3 years of cardiothoracic, and a year of peds heart.
Great. Thanks, Joe. And last but not least, my favorite chief resident here at this institution, Dr. Wilder.
He didn't tell you guys that I'm the only chief resident at Johns Hopkins, so it'd be bad if I didn't win that prize. Hi, everyone. Thanks again to Dr. Yang and Dr. Sachdeva and to the ACS for giving me the pleasure and honor of being here. As Dr. Yang mentioned, I'm one of the CT surgery fellows here. There are 2 of us per year. I am originally from Nigeria. Family is from there, and I was born in New York and kind of raised between there and here in the States. New York is home and New Jersey, but I've kind of traveled across the country for my training. I went to the Ohio State for medical school, and then was in New Jersey and then California for my residency training. I did spend a couple of years in the lab at Memorial Sloan Kettering, and then finished up residency in California before matching into CT surgery out here at Hopkins. I represent myself as a cardiothoracic surgery fellow, but my passion and interest and future lies in thoracic surgery, which is what I'm currently interviewing for. My areas of interest, obviously, within thoracic surgery are in thoracic oncology primarily, and esophageal malignancies as well. I'm part of the TSRA, the Thoracic Surgery Residents Association Executive Committee, and that's where I've been able to have a lot of influence with education and just trying to promote education of trainees and finding ways to improve that process. Dr. Yang and actually Dr. David were instrumental in the early parts of my finding my way in the field and identifying that thoracic surgery is what I wanted to do. And Dr. Yang continues to be a huge mentor in that. So I'm very happy to be here, and I look forward to answering questions.
Thanks, Fatima. And despite your Ohio State background, I still love you.
Thanks, Dr. Yang. And I also, just to congratulate Dr. David, and I'm also a mom of 2. So if anyone has questions about that as well, I'm happy to answer. It's a great thing.
Which actually brings us to the first question from the chat, is about, and I call it more work-life integration as opposed to balance. And so maybe everyone can talk a little bit about their work-life integration. Maybe Fatima, since you started it, we can go with you.
I think anyone on this chat would say if you have a family, you must have a strong support system in surviving this field. For me, it's been primarily my husband, because we've never lived in an area where we've had family nearby. So him and I have been pretty much it for our children. And I think without that, I don't think this would have been possible, at least not for me personally. So having a support system that can be there for you when you're inevitably unable to be there for all of the important things in your family's lives is a very key component, I think, in maintaining that balance, because they also keep me grounded and help me remember that there's more to life than just the hospital. I think, being honest with yourself and having supportive colleagues and mentors in my situation that can kind of remind you to take a little bit of time for yourself. Those have been the two main things in helping me maintain balance thus far.
Great. And then, so you had your children during training.
Yes.
Elizabeth, you had your children past training.
Yes. So I did. I am 43 right now. I had my first baby at 42, and I'm obviously having another one very soon. And I would echo what Fatima said. I think, I've sort of stopped saying that you can do it all. You can do it all, but you can't do it all the time. And having tremendous support and my husband, I couldn't do it without him. We have extremely supportive nanny who treats our daughter like she's her own granddaughter. And without that, because my husband works as well, it wouldn't be possible. That being said, I'm careful about the way I schedule cases, and I'm, respectful of when he's going to be traveling. So I don't operate usually when he's out of town, just in case there's an issue that comes up. So there are ways to do it, but it takes a lot of planning and a lot of time management, but that's true of most things in surgery. So I would just encourage you that you can do it, but you can't do it all the time, probably.
Okay, Joe or Wilson, any thoughts about your work-life integration?
I think we've had a number of these quality of life surveys that have been done in cardiothoracic, and every one of them that I've ever looked at, the pediatric cardiac surgeons claim to have the highest quality of life. And I'd have to agree with that. I mean, we do some very interesting cases, but I think just like what Elizabeth said, I think a lot of it has to do with just really planning out well. I coach my son's basketball team. But I make sure that on game nights, those aren't days that I'm scheduling big cases to go late into the night. We don't do a lot of emergencies in pediatric heart surgery. So, other than an obstructed total veins, that's really about all we get called into in the middle of the night for. And a heart transplant, we know ahead of time. You have probably a good 8 hours planning to be able to come in for that. So, my quality of life is excellent.
Wilson is a cardiac surgeon.
Yeah, it's tough. And I just want to lay down some realistic expectations for the medical students. It's tough. Having said that, I think there are quite a bit of variability and flexibility in terms of your priorities, what you choose them to be. I would echo the support system is key. I've been very fortunate to have a wife. I'm a father of two, who's been extremely supportive. She's also a physician. She's in primary care, geriatrics. So her schedule is a little bit more flexibility. I would also add that support goes beyond your personal family. I view my partners here at Penn as my personal family. We watch out for each other. And I think that will be important as well in terms of, the type of practice you choose, the type of subspecialty you choose. So I would echo everything that's been said. I think the job is extremely rewarding. I think it goes with the territory. I think you're hearing it, to the medical students, that surgery does have higher intensity associated with the role. That's some pluses and minuses. But I think careful planning, setting boundaries, recognizing your priorities, and having a strong support system can and will allow you to have a very productive professional life and personal life. I'm extremely happy and have no regrets. And I would choose this field all over again if I had to choose it again.
Great, thanks. I said, I don't really use the word balancing, or I use more integration, because, there's, some of us do have, maybe all of us do have a lot of flexibility. There's times we're at work and we have to take care of home stuff. And then obviously when we're at home, we're taking care of work stuff. So that's why I use that term pretty strictly, that, there's really no like off time and on time. So again, depending on how you want to regulate your practice would be that. There's a couple of questions on I-6 programs. So sort of a two-part question is that, students are applying to I-6 programs, and you're also told to apply to general surgery. And it's pretty obvious that they know, based upon their CV, that they want to do CT surgery. So, what, any suggestions on how to strategize with that? And then the second part is, how do you decide you want to do an I-6 versus say like a 4+3? So maybe Wilson, why don't you take that, because these I-6 programs are more cardiac oriented.
I would have totally agree with you, Steve. And I'll just provide you with my perspective. It's just one perspective. We are here at Penn. We are fortunate to have two pathways. Out there are three. There's the I-6, there's the 4-3, and there's the traditional 5-2. At Penn, we have two paths because we recognize that individuals get to a destination through different paths. So we want to be open and create an opportunity for students and residents of all kinds. So we have the I-6 and the 5-2. The I-6, in my opinion, gets you started earlier. It is very cardiac, at least at the program here at Penn, is very cardiac heavy. It's not, at least at Penn, designed for a thoracic track type of approach. I guess the best way I could summarize it is that the I-6 is really designed to train a cardiovascular specialist. And what I mean by that is, on day one, you're immersed into all of cardiovascular pathology treatment. You spend time not only in cardiovascular surgery, but also basics in cardiology, CCU, that's the critical care unit and cardiology unit, imaging, for example. So I think the focus on an I-6 program, at least here at Penn, is more of a cardiovascular specialist. In contrast, the 5-2 probably have a more focus on a broader general surgical training. It's much more heavy on general surgery your first 5 years, followed by a very intense 2-year subspecialization in cardiothoracic surgery. So I think both paths are very valuable. I wouldn't say one is quote unquote better than the other. I think it would really depends on your goals and what your priorities are and what you're trying to achieve.
And then Elizabeth, maybe on the flip side, there are some 4-3 programs, and your thoughts on what type of students should apply for those.
Yeah, so the 4-3 programs, that's a program where you're going to match into a general surgery residency. And then at that institution, if there is a 4-3 program available, you'll know about that when you're applying for general surgery. And then you would talk to them, express interest, and then usually around the second or third year of the general surgery program, you will make a designation to enter the 4-3. And that means that you would essentially sort of divert out of the general surgery pathway after 4 years and then move into their cardiothoracic residency training program after that 4 years. And so you'd spend 3 years essentially doing CT. There are not that many of those programs. And so, I would just caution you about that, that the 5-2 or the traditional pathway is very common, and the integrated pathway is becoming also very common, but the 4-3 is much less common. I think, Steve, are there 8 programs?
Yeah.
It's a small number. It's less than 10. So not very many people do that pathway, but it is a great training pathway. You just want to be very upfront and open with the program when you're applying as an intern. And so I do think it is a great program. I would echo what Wilson said. I think everybody here on the panel, obviously has gone the general surgery route and then did further subspecialty training. That's because the I-6 programs are still relatively new. So there are people in practice now who have completed the I-6 pathway, but it's not the norm in practice yet.
And there's just for some information for the younger med students, an I-6 means an integrated 6-year program, which means you match directly into that. You do a few years of general surgery, but you won't be able to get board certified in general surgery. So you do maybe 1 or 2 years of general surgery and then progressively do more cardiothoracic. So the total time in clinical training is 6 years, but some programs or most programs now are also moving toward adding research. A couple questions on just how we picked cardiothoracic surgery. I know some of you alluded to earlier. Some good things that sparked your interest, and what are some hot topics in our subspecialties right now? So maybe start with the youngest, Fatima.
For me, it was 100% exposure. So I didn't actually decide specifically to pursue CT surgery until I was a 3rd-year resident, which is actually pretty late for most people. I was on a rotation at one of our smaller hospitals, and the cardiac surgeon I was working with, I saw how much interest there was that I expressed in the field. And he talked to me about both sides. He knew I was a mom already at that point and told me to look into both, obviously, but mentioned kind of the benefits of thoracic surgery in terms of a little bit more control over your schedule and lifestyle. So from there, I went to STS, and that's where I met an attending that introduced me to another attending that suggested that I spend some time shadowing. And at my program, there wasn't a dedicated thoracic surgery department, or surgeons, I guess I should say. So I actually spent a week of my vacation at UC Davis, which is where Dr. David was at the time. And with her and some of her partners, I was able to shadow, and just after that week, I was committed. So that was a very specific time that I was exposed to the field and went and saw it for myself, and was pretty much sold after that. I think what some of the things that I love are that you get to operate on people with obviously, malignancies, very complicated disease processes. Some of it is benign disease. You get to make a real impact, but there's still a lot of room for growth. So research is a big thing and a big area of research of interest for me. So you're constantly challenged in multiple ways in thoracic surgery. You're challenged in the operating room. And then on top of that, the people that you get to work with, I think as far as colleagues, were also a huge appeal for me, because I found myself just meshing well with this group of people in the field. And although it's sacrifice in terms of the training and the length of time it takes to get there, just that satisfaction at the end of the day, knowing that you've made a real impact on someone and you've enjoyed doing it, yet there's still more you can do. So there's no room for complacency. I think those are all many of the reasons why I love the field and what attracted me to it.
And Joe, what got you excited about congenital?
I think a lot of it has to do with mentorship, and if you find someone that can serve as a mentor. I went into medical school thinking initially that I wanted to do surgery. I wasn't sure exactly what type of surgery I wanted to do. I saw my first congenital heart surgery. It was a transposition in a newborn. And after I saw that, I thought, wow, this is something I could really want to do. I happened to contact Dr. Aldo Castaneda, who's a legendary pediatric heart surgeon that was the chief at Boston Children's for, a quarter of a century, had just retired recently. And in his retirement, he started the only pediatric heart surgery program in Central America down in his native Guatemala City. And I reached out to him just randomly and asked if I could join him for the summer. It was the summer before one of my last years of medical school. Obviously, I was in medical school for 8 years, so I was there a while with my PhD. But I spent the summer with him, and it was really a life-changing experience for me. And it was clear after that experience that was the only thing I wanted to do.
And then, Wilson, for a couple questions here on, so you decided to be a cardiac surgeon. Why not cardiology?
Great question. I think, again, back to exposure and mentorship. When I was 18 years old, I was a senior in high school, spring break. I decided for my week off to spend a week at my local hospital, Norfolk General. I grew up in Virginia Beach. And I spent some time in the operating room because I thought I wanted to be a surgeon. I kept going back to the cardiac surgery. I just couldn't get enough of it. So I think to the points made already, mentorship and exposure. And when I saw the acuity, the intensity, the immediate impact that the specialty has on an individual, I really just gravitated to that. And I felt that this was something I wanted to do as a professional pursuit.
Great. And it's really crazy. We've had 27 questions, and so I'm sorry we can't get to all of them, but we'll try to type these as we go along. But maybe the last question for Elizabeth. There's a lot of M1s and M2s out there. What do you suggest them to do during the summer? Should they do research? Should they find a mentor? What are some things that you suggest them to do?
Sure. So I think that what I would recommend, I know the college is going to send out some resources to you all attending the webinar tonight. I would encourage you to take a look at the websites for the AATS, the STS, the WTS, and the Asian Cardiovascular Society. Is that the right name, Wilson?
Correct. ASCTVS, Asian Society of Cardiothoracic Vascular Surgery.
Yes. Okay. Thank you. And because all of those organizations, in addition to the Southern Thoracic and the Western Thoracic Associations, everybody has programs for medical students and interested folks in their field. And so the programs range from scholarships to attend the meetings. They also, some of the organizations have summer research opportunities or ways for you to get funded for summer research that then connect you with a mentor. Anything like that, I think, is a great opportunity to explore. Also, if that's not something that's feasible, finding a local surgeon to spend some time with, just one-on-one, or, that kind of summer shadowing opportunity would be great also. You making that type of investment in yourself is going to pay off in the long run. It's going to pay off. It's going to yield other opportunities that will help build your CV and your residency application, which I know there are a lot of questions about. But I think the biggest thing is to make the investment in yourself, because that speaks volumes about your level of interest and your ability to follow through on tasks, which are things that people are really looking for in residency applicants.